My name is Bjorn Gebauer. I'm from Germany. I'm still a med school student in my basically last year of studies, and the fifth of the 6 years clinical training in Germany. And yes, I'm attending this congress for a poster presentation and a short oral presentation. My research interest is basically oncological surgery, or surgical oncology, if you like. And today my poster presentation is on the influence of diabetes mellitus onto the long-term outcome in rectal cancer surgery. And the presentation tomorrow is going to be the same topic, but with the BMI, so the body mass index influence onto the long-term outcome in rectal cancer. The take-home message is that you have to be aware of those influences, because the BMI is influencing the long-term outcome. Otherwise, it's not good, but due to its related comorbidities. And on the other hand, a higher BMI, so overweight or obese patients, do have a better overall survival and better survival rates. I think it's not that important for students. It's more important for practical practitioners, so the people who are in surgery. But which is important for students is to know that they can participate in such conferences. Those congresses can do research during their studies, and should definitely pursue that. The first message would be start early and start as much as you can, if you like, and you have to be aware that it is more difficult to do study and research at the same time, but it's definitely possible for everybody. And yeah, the second message is do it. Just search somebody who can be your mentor, like a professor or a doctor, whoever, and then take his or her advice and attend those conferences. And by the way, most of the conferences are free for medical students, so just do it. The future of surgery in Germany, I think we are at a very good state at the moment. The coming challenges are definitely the lack of people who want to go into surgery, so there has to be a little bit of change in mind to make young people to want to become a surgeon again. How this is going to look like, I'm not really sure. Maybe this whole Generation Y discussion can lead to a solution for it, so that both generations, the ones on top, the leaders, and the young generation, can discuss how to make surgery. And this collaboration is, I think, the most important part in Germany and globally. I think we have to be aware of the importance of surgery in medicine. And for example, yesterday I attended a talk about the surgical burden in developing countries or middle and low income countries, so that basic surgical access for most of the people can be more valuable than huge amounts of medicine for HIV, tuberculosis, and so on. So the global community has to be aware of that.
Thank you for your time.
You're welcome.